one of the variants of the case control studies within a defined cohort. That is the first one of it is the nested case control study or the density case control study. So this nested case control study is a case control study which is conducted within cohorts of exposed and unexposed people. Because at the initiation of the study, the plan is to conduct a prospective course design. So the study is initiated by identification of exposed and non-exposed groups. So then we'll follow them prospectively for the purpose of doing a course design. Okay. The control series can be selected by sampling randomly from the cohort. After a certain period of follow-up, during the follow-up, we will get cases with the disease. So the cases will be taken as a case group, and the controls will be selected from the healthy individuals who did not develop the disease during the follow-up among the cohort group, either from the exposed group or from the non-exposed group. If they are not, if they did not develop the disease, they could be selected as a control. Okay, the cases could be obtained from either from the exposed group or from the non-exposed group. As far as they develop the disease, they will be taken as a case. So that is the nested case control study design. Okay, such an approach is a particularly efficient way to deal with expensive tests that would otherwise have to be made on tens of thousands of individuals. If we follow the full cohort, that will just take resource on collection of the data on tens of thousands of individuals if the full cohort is followed. Okay, so a nested case control study is another type of case control study that is embedded in an open cohort study. We'll see what open cohort study mean. There's a closed cohort study, open cohort study, and maybe there are three types of cohort studies. The open cohort study, the closed open study, and then maybe I forgot one of them actually. I will say when we see about cohort study designs. Open cohort study design is a design in which individuals can enter into the study at any time or can leave out the study from any time. That is the open type of cohort study design. Yeah. So with this approach, it is not necessary to wait until the end of the follow-up to select controls. No need to wait until the end of the follow-up, So during the follow-up, as each case arises, as we get a new case, one or more controls will be selected from the cohort members who are free from the disease. So that means when we get a new case, okay, so immediately one or two controls will be selected. If the ratio is 1:1, so when we get a new case, one control will be selected. If the control to case ratio is 2:1, so that if when we get one case, two controls will be selected. That is the idea. So controls are a random sample of the individuals remaining in the cohort at the time each case occurs, where each cohort member has a selection probability which is proportional to the percent time experienced by that individual. For example, if a case is staying in the follow-up for 5 years, so that a control with a follow-up of 5 years will be selected. That is it. So for example, someone with 5 years of follow-up would have a selection probability that is 5 times the selection probability of someone with only 1 year of follow-up. So that the probability of being selected will be proportional to the time that the individual is staying in the follow-up period. So this nested case control design is based on a sampling approach known as, you see, I said before, there is a sampling method for case control study design, a separate sampling method that you didn't know in a biostatistics course. So the sampling method for the nested case control study design is known to be, or known as, incidence density sampling or risk set sampling. That means when you get a new case, immediately you will randomly select a control for that specific case. Okay. Cases are compared with a subset of the risk set, that is, the court members who are at risk at the time when each case occurs. When a case occurs, so that the population at risk who are free from the disease will be selected. One or two or more than two controls will be selected for that case. In this way, look over here, the case and the corresponding controls which together form what is called a risk set are matched on the follow-up time and possibly maybe with other variables. Especially we need to match the case and the controls in the follow-up time, you know. If a case is found, a case of having 5 years follow-up is found, so the control should be taken from individuals who have a 5-year follow-up. They should be matched on the follow-up period. And maybe if necessary, they should be also matched in other variables. So the risk set approach to selecting cases and controls have a number of characteristics, features. Look over here. You see, the most important thing over here is a subject can be selected as a control for more than one risk set. Let me just draw one thing over here for you to make it clear. For example, at the 6th year over here, if you get a case, let me just call the individual A is a case at the 6th year follow-up, you know, and then you select the control which is B. Okay, in the 7th year, the case is already case. It will remain there. Okay, now you get an additional case which is called maybe C, an additional person C. Okay, now in the 7th year, a person B who was selected as a control at the 6th year may become a case, you know, may become a case in the follow-up period. At the 6th year, he was a control, but during the follow-up period, he may develop the disease. So here, the person B will be shifted from the control group to that of the case group. So B will be just shifted to the case group. So we will select another control from this. We may select another person D and E who are free from the disease. But during the follow-up again, the controls may become a case. You see, that is the issue or the characteristics of this nested case control study design. So that is what is written here. That means a subject can be selected as a control for more than one risk set. A subject who is a control in one risk set and subsequently develops the disease becomes the case in the corresponding risk set. That is the one that I have already shown you in the graph or in drawing a graph. A subject who becomes a case is no longer eligible to be a control. Once the patient is, the person have developed the disease, he will not be eligible to be a control, you know. He will remain in the case group because he have already developed the disease. But an individual who are considered in the control group will be or may become a case in the coming year or in the coming follow-up period. That is the nested case control study design characteristics. Okay, so by using this strategy, cases occurring later in the follow-up are eligible to be controls for earlier cases. Look, cases occurring later in the follow-up are eligible to be control for the earlier cases. That means the past history of the control period for a case will be taken as a control, you know. That means a case which is occurring in the later follow-up are eligible to be control for earlier cases. That is the idea. Okay. So now, generally, this is a way how to just summarize in terms of graphical representation, you know. And as I have said, this is a time. We'll have a defined source population over here. And a core study design is designed and the follow-up is over here. So now, these lines, dot, with these dots are the cases. As we get, these are lost follow-ups. These are lost follow-ups. But as we get a case, a control, this bar, a standing bar is representing a control. As we get a new case, so that a control will be selected. And again, there will be loss to follow up. And again, if we get another case, then a control will be selected. And again, if we get another case, then a control will be selected immediately. And there will be a loss to follow up, since it is a follow-up study design or a court study design. When we get again another case, then a control will be selected. With this approach, we'll just select the controls based on the record of new case. That is the nested case control study design. So the sampling method is risk set sampling method or incidence density sampling method. This is the sampling method for the nested case control study. So incidence density sampling is the equivalent of matching cases and controls on duration of follow-up. Because we use incidence density sampling or risk set sampling because in order to just match the cases and the controls in terms of their duration of follow-up, So this permits the use of straightforward statistical analysis. If we match the cases and the controls in terms of their duration of follow-up, so that straightforward we can do statistical regression method without any complication, Maybe standard multiple regression procedures for the analysis of matched or survival data, We can do that. So risk set sampling or incidence density sampling method is the best sampling method for nested case control study. So now let me show you an example and we'll wind up today's class, after showing this example. Suppose that investigators undertook a prospective court study, which was initiated in 1980, to determine the causes of chronic diseases among middle-aged women in the United States. And actually, I said suppose, but this is an actual study in the United States. And actually, the examples are already actual studies that I already brought from different literatures and textbooks. So investigators decided to conduct a general cohort study, and therefore they assembled a group of 100,000 female teachers. You see, the total cohort for the study was around 100,000 female teachers between the age of 45 to that of 65. And mind you that the study is initiated in 1980. Okay. They planned to examine numerous risk factors. Among them, like for example, the use of contraceptive, the type of diet, smoking status, alcohol consumption, and environmental exposures. These are the exposures which were considered. And so they collected data on these characteristics as well as data on health outcomes and other key variables. Data on health outcomes. Okay. Investigators use a combination of periodic interviews, physical examinations, and laboratory tests to gather this information. In particular, blood was drawn from all participants at baseline during the initiation of the study. From all the participants, that means from the 100,000 female teachers, at the baseline blood was drawn. And these samples were processed and frozen for later use. They were placed in freezers, Okay, that is the most important issue. Okay, now, in 2015, that means around after 35 years, because the study is initiated in 1980, and in 2015, after 35 years, the study investigators became interested in the hypothesis that pesticides such as DDT increased the woman's risk of breast cancer. They started to hypothesize that there could be a risk of developing breast cancer because of pesticides such as DDT. That is the hypothesis which comes to their mind after 35 years, in 2015. Okay, now, data from other studies or from other literature suggested that this compound, that is DDT, could increase a woman's risk by mimicking the action of endogenous estrogens. With a similar action of estrogens, DDT could increase the risk of developing breast cancer. That has been suggested by different literatures, and they read. Now, the investigators decided to measure the serum levels of DDE, that is the metabolic byproduct of the pesticide DDT. That is the byproduct of DDT, that is DDE. Abbreviation actually, the full term is given over here. In the frozen blood sample taken from the court members in 1980. You see, the frozen sample was kept in 1980, and they plan to use it after 35 years in order to measure the DDE level within the blood of the individuals. To measure the association of this DDE level, high and low, with that of the breast cancer status of the female teachers. Now look over here. Even though the DDT was banned in 1969 in America, it is quite persistent, and therefore serum levels taken in 1980 should give a fairly accurate estimate of past exposure. So that has been already suggested, So the investigators sent the 100,000 samples to laboratory for DDE analysis. Okay, now the problem is here now. How do they just analyze 100,000 samples of DDE? So upon receipt of the laboratory results, the investigators characterize the cohort according to the DDE level as being high and low DDE level. So in addition, they examined the health outcome of the data collected so far, and around 2,000 study participants were found to develop breast cancer. So that out of 100,000 individuals, 2,000 of them have developed breast cancer during 35 years follow-up. So the remaining 98,000 are free from breast cancer. Okay, now, but the laboratory result is done for all the controls and for the cases. So now, the investigators arranged the exposure and outcome data in a 2x2 table, which is given in a table in the next slide. Let me show you over here. The total population is 100,000. Breast cancer cases are 2,000 during the follow-up period in the 35 years. Without the breast cancer, 98,000. Okay, now the DDE level was analyzed for all the samples and classified as high and low. So the high group is around 15,000 and the low DDE group is 85,000. So that the relative risk, since it is a cohort study design, was found to be 1.89. That means female teachers with high DDE level are 1.89 times more likely to develop breast cancer than the female teachers with low DDE level. That is a conclusion. But this is not the issue. The problem is, let me go back to the previous slide. The problem is not to the previous, rather to the next slide. The problem is, unfortunately, there was a major problem in evaluating the hypothesis in this manner. Why? Quantifying the DDE serum levels was very expensive for the whole cohort. It takes around $100 per sample. If you multiply this by 100,000 total cohort, so the final cost will be $10 million. That is really very costly, $10 million. Okay. Note that the cohort study approach in this setting is prohibitively expensive. That is expensive. So what would have happened if the investigators had used a much less costly approach, such as a case cohort study that is nested within a cohort? So rather than analyzing the full cohort, with a laboratory test, it is better to use a nested case control study design by taking the 2,000 cases as a case, and out of the 98,000 controls, random selection of controls could be taken to minimize the cost, you know. So that would be the better approach, using a nested case control rather than using the full cohort, you know. So how would they go about conducting such a study? First, they would have analyzed the baseline serum sample of the full cases, the 2,000 cases, who were diagnosed with breast cancer. That is the number of cases. Next, they would have carefully selected or randomly selected a sample of the cohort to be the control group among individuals who are free from breast cancer. So that let us assume that out of the 98,000 free individuals or healthy individuals, 4,000 women could be selected as a control, you know, 4,000 women. Okay. So now, by doing this nested case control study design, the result will be in such a way. Now the cases are the same, 2,000, but the controls are not 98,000, rather random selection of the healthy individuals, that is 4,000. So the DDE level was measured again from these two groups, high and low, with this number given over here. So the total population for the study was now 6,000. Rather than 100,000, it is now 6,000, which will be less costly and less time taking. So if you calculate the odds ratio for this nested case control study design, the same result is obtained, you know, 1.89. You can calculate it, AD over BC. So the same result and the same conclusion will be arrived by the use of a nested case control study design, which is more efficient in terms of cost and time than using the full cohort, which is not cost effective, you know. So using such a nested case control study design will have an advantage of having a methodologically soundness, which is taken from the property of the prospective cohort, which minimizes the selection bias and recall bias. And again, the advantage of case control study design, which is cost effective or efficient. So in this approach, a nested case control study design could be conducted within a defined cohort. So now, this is already what I have said. The investigators could have used this data to estimate the relative risk of breast cancer among women with high and low DDE level. The estimate would have been similar to the relative risk calculator for the entire cohort, as I have shown you. So the most important of these conditions would be the proper selection of the controls. What we need to take care is that in selection of the controls, there should be a proper selection, especially the risk sampling method should be used, because the nested case control study approach is used, you know. Note that the nested case control study is much more efficient than the cohort study, because the total cost in using a nested case control study design of a sample of 2,000 cases and 400 controls is now around $600,000, which is much less than $10 million when it is used for the entire cohort. That is more efficient, more efficient. So that is why case control studies nested within or defined within a defined cohort is appropriate. So the cases in both studies, that means in the nested case control study design and the entire cohort, are the numerators. They are the same, 2,000 number of cases. The denominators are slightly different. The total number of persons or person time forms the denominator in the cohort study, whereas a sample of a person or a sample of person time forms the denominator in the nested case control study design. That is the slight difference, because we take random controls rather than taking the whole healthy individuals, you know. So this sample is known as a control group. That is the way how a nested case control study design could be conducted within a defined cohort. And actually, the last example, since I do have some 10 or 5 minutes will be enough, you know, to show you this example. And actually, this example will be again elaborated in, during the discussion of experimental study designs, especially a factorial experimental study design will be used for this example again. So the second example for this nested case control study is the physician's health study was, which was conducted in America actually. The physician's health study was a double-blind, placebo-controlled, 2x2 factorial randomized control trial. We'll see each of them when we talk about experimental study designs. I will not take time to say anything about these types of designs at this point because they do have their own place and their own time. So this physician health study was, as I have said, was a double-blind, placebo-controlled, and 2x2 factorial randomized clinical trial conducted to investigate whether low-dose aspirin decreases cardiovascular mortality and whether beta-carotene reduces the incidence of cancer. This paper was published in 1988 and 1989. You can refer it. And actually, this is an updated research, a current research. So now, a total of around 22,171 US male physicians in the age of 40 to 84 years were involved in the study. Why physicians? Because, you see, the study of beta-carotene and aspirin with that of cardiovascular disease requires an understanding of clinical science, So that is why the study population was were to be physicians. So these physicians were without no history of heart attack, a stroke, or cancer. They were free from the disease at the initiation of the study. And who met also an additional inclusion criteria. If you read the paper, there are a number of additional criteria. Were randomly assigned to receive one of the 4 treatments. We do have 2 active treatments, that means the aspirin and the beta-carotene, and 2 placebos, the placebo for the beta-carotene, the placebo for the aspirin. We do have 4 types of drugs, 2 placebo and 2 active drugs. So the random assignment or allocation will be just taken place in 4 options. We'll see it, this in detail in the experimental study design actually. What I want to show you here is, based on a well-defined cohort in doing experimental study, it is also possible to do a nested case control study design. That is the issue that I want to tell you here now. So there were around 11,035 subjects in the active aspirin group and around 11,034 in the aspirin placebo group. Based on an attention to treat analysis, as I have said in the morning session, intention to treat analysis and efficacy analysis are the ways of analysis in experimental study. The aspirin component of the trial was terminated early because after an average follow-up of 5 years due to a beneficial effect of aspirin on the risk of fatal and non-fatal heart attack. It was found to be effective in reducing heart attack, So if it is effective, then you need to just terminate the study and you give the drug for the patients. And then now, blood samples collected at the start of the follow-up from all subjects in the physician's health study were used to conduct a nested case control study that investigated whether a mutation of the gene coding for a certain coagulation protein, the coagulation factor 5, whether it increases the risk of heart attack, a stroke, and deep vein thrombosis or not. And this paper is published in 1995, So this is the output of a nested case control study design, which is based upon that randomized control trial. So the cases were subjects with a confirmed diagnosis of any of the preceding 3 conditions. That means whether heart attack, stroke, or deep vein thrombosis. So these were the cases. So that respectively 374 stroke cases were there, 209 heart attack cases were there, and 121 deep vein thrombosis cases were there. And for each of the cases, among the healthy individuals, randomly controls were taken for each of the groups. Each case each case was pair matched to a control using risk set sampling. The sampling method should be appropriate. With matching on time since randomization and age and smoking habit, these variables were matched. So the key finding was that the gene mutation was associated with an increased risk of deep vein thrombosis, but not heart attack or stroke. So the gene mutation was found to be associated with an increased risk of developing the deep vein thrombosis, but not for heart attack or for stroke. That is the finding which is reported from the nested case control study design. You see, if you have understood the idea, after getting enough number of cases during the follow-up of the experimental study design from the healthy individuals, for each of the 3 types of diseases, controls were randomly selected by the use of risk sampling method. And then a nested case control study was done, and the finding was concluded in such a way. So this is the way how a nested case control study design could be made within a defined cohort study design or within a defined experimental study design. So the advantage of nested case control study is the investigator is able to test new hypotheses, We are testing a new hypothesis which was not developed at the initiation of the study. Whether it is a cohort study or experimental study design, it was not developed at the initiation of the study. The hypothesis designed for doing a cohort or experimental study design was another hypothesis, But after a certain period of follow-up, investigators will develop a new hypothesis and test it with a nested case control study design. And the baseline data is collected before the outcome is known, That is the characteristics of, or the advantage of follow-up studies. And it saves against money and time, which is the advantage of a case control study design. That is the advantage. Okay, when we compare the nested case control study design with that of the ordinary one, the ordinary case control study design is done under undefined source population. But the nested case control study design is done among well-defined source population, and it does have both the advantage of case control study designs and cohort study designs. So that is the idea of nested case control study design. So that next week we'll proceed with the remaining types of case control study designs. So this is what I have for you today. I thank you very much.